Well, following the holidays, COVID cases are going up all around the country.
Yeah, to give us some insight, Dr. Bhavna Lall, the clinical assistant professor of adult medicine in the Department of Clinical Sciences at the University of Houston Fertitta Family College Medicine. Sorry, I hope I didn't botch your name too bad. Good morning. How you doing?
Good morning. How are you? It's Bhavna Lall. Thank you so much for having me.
Thank you.
Great. Well, Doctor, thank you so much for joining us this morning. And we know we're hearing about this new variant that's been spreading really quickly. What can you tell us about it?
Sure. Thanks so much for having me. So XBB 1.5 is spreading rapidly throughout the country. And cases, of course, have been rising in the Northeast, but also spreading throughout the country now as well. And it's more transmissible, so more contagious than other variants we've seen with the Omicron variant. So it's really important to stay vigilant, given cases are going up throughout the country, and also cases, of course, we're seeing surges of COVID in other parts of the world as well.
And Dr. Lall, what's the impact been of this new highly contagious variant?
So the impact is that we are seeing more hospitalizations around the country as well, including in Texas. And it's also reaching out to people who have been previously infected and vaccinated. So it's important that you remember that even though you may have been infected before or vaccinated, you still are at risk. And so it's really important to actually take the new vaccine, the bivalent vaccine, so that you have increased immunity as well to prevent severe disease. And also, if you're high risk, and if you want to take more precautions, wear a mask, of course, continue to wash your hands, stay vigilant, test before gatherings, especially with vulnerable individuals. And also, you want to make sure also that you remember that we are still in a pandemic, although we're in the fourth year of the pandemic. So be vigilant of that. So if people are concerned about spreading this disease, there are true concerns here, and so we want to be mindful of that. So if you're high risk and you do get sick, there is treatment available. Paxlovid is available, which is a oral antiviral treatment that's available within 5 days of symptoms. So if you do get sick and are eligible, you can get this medication through your doctor, through local pharmacies, and also if you don't have insurance, through federally qualified healthcare centers as well.
Very helpful information. Yeah. Well, Doctor, can you walk us through how some of these new variants of COVID are discovered?
Sure. So genomic sequencing actually happens in multiple sites throughout the country. And it's a way that public health is actually studying the COVID variants. And essentially, when hospitals are testing for COVID, they're actually doing genome sequencing as well. So we're able to get a sense of what variants are actually spreading. Unfortunately, now with rapid testing happening all over the country, which is great, that's a great tool that we have, we're not actually getting the variants picked up from the rapid testing, but if people are hospitalized and if they're actually doing PCRs, they are getting into the genomic sequencing as well. So if you do get a PCR done at a clinic, you will be possibly getting genomic sequencing done as well.
Well, Doctor, one of the questions I wanted to ask, I feel like we're sort of always one step behind COVID and these variants. I mean, is there ever a point where we get ahead of it finally?
Yeah, I think that this is what people are feeling with this variant as well, given we've known about this for a couple of months, but given the holidays, as you know, people were traveling on planes and people are not wearing masks at airports and planes. So I think we are a step behind. I think we need to continue to stay vigilant. And actually, before these surges happen, we need to think about masking on planes, masking in airports, and masking in public areas that are at high risk, for where people are actually high risk of getting infected as well, including large crowds as well.
Well, Dr.
So hopefully, yes.
Yeah.
Well, we're so grateful for your time and your expertise and input on this. Thank you so much for joining us today. And remember,
thank you so much for having me. Stay safe.
You as well. Thank you so much. And make sure that you can join in, visit our clicktohouston.com. You can search for the keywords COVID-19 and Scene at 7. Thank you so much, Doctor, for joining us.